You can invite as many friends as possible. Today is a very, very special episode. You can invite as many friends as possible. Today is a very, very special episode. Yeah. Hello. Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon with you. Today, we are going to learn the best techniques for enhancing our quality in reading and enhancing our skills. Don't miss today's session under any circumstances. Yeah. Good evening, Lahari. Yes. So, right. So first, we are going to learn solid points today. We're going to take exactly 30 minutes. Afterwards, okay, the techniques we will learn in 30 minutes. Techniques only in 30 minutes. Techniques only in 30 minutes. Afterwards, you can do your test and you can tell me your marks. Okay. I'll give you the question paper. You can do and you can give me. I want you to get 20 out of 20. Okay. I want you to get 20 out of 20. That's what I'm expecting. So in the meantime, so let us invite our friends, at least one friend each or two friends each. Try to invite. Yeah. All right. Fine. We have the text here. We have the text here. I'll put in front of you. So we have the text and we have questions for part A. And yes, a very special test, official test. Okay, official test. Right. Now, first we'll be dealing with part A. First, we'll be dealing with part A. Part A. So the question for us is, can we get 20 marks out of 20? Yeah. Can we get 20 marks of 20 out of 20 in the part A of the reading test? Can we get 20 marks out of 20 in the part A of the reading test? That is the target. Okay, if we don't get, that doesn't matter. But why don't we try to get 20 out of 20 marks? Is it possible? Do you think for you? Is it possible? Today we have to fill in our heart with courage, confidence, and passion. And not last but not the least, a desire, burning desire. So these are the things, okay, right? So confidence. So this, you have to fill yourself with confidence. The next one, passion, passion. Then burning desire. So confidence, passion, and burning desire. Okay. So this you have to fill into your heart in order to get 20 out of 20 marks. If you get 20 out of 20 marks, 20 out of 20 marks, okay, then out of the remaining 22, 10 only are needed. Only 10 questions are needed. 10 questions only are needed from the rest. So that means less than 50%. Less than 50% in the part B and part C. Okay. So part B, 2 out of 6. Part B, 3 out of 8. And 3 out of 8. 2 plus 3 plus 3. Enough. So that's it. So that is our target. Target 20. Target 20 out of 20. This you should take a steely resolution, firm determination, firm determination, or a steely resolution. Okay, words are very tough, but you have to take. Now, are you ready to unearth the secrets? Are you ready to unearth the secrets? Yes. So, so will you try? If you are ready to try to get 20 out of 20, put your heart, mind, and soul. How many of you are ready? Sign there with your name. Sign there your name and your sign there today. Today, sign there. I will try. I will get different story. I will try. My target is 20 out of 20. Take a decision and type your name. I will be inviting you for regular sessions, even personal sessions. So I am Simon Peter, and it is my decision as a trainer, okay, to support you to get 20 out of 20. Are you ready? As a student, write your name, okay, and your profession, okay. If you have decided to try for 20 out of 20, write your name and your profession. Sheetal Singh. Sheetal Singh. Victoria, I'm getting 20 out of 20. Yeah, you are getting 20 of 20. You are correcting. Send it to me. I will find out where you may go wrong in the exam. That's good. Getting 20 out of 20 is good. No doubt regarding that. But the thing is, maybe because of your handwriting, okay, maybe because of something else, clarity, neatness, singular, plural, word forms, legibility issues, okay. So many things are there. Punctuation, hyphenation, many things are there. So this may trouble you. Yeah. Very good. There are some students who have resolved. Good. Now we'll go to the points. So let us learn two different things. Let us learn two different things. Number one, skimming. Number two, scanning. So we are going to learn skimming and scanning. Skimming and scanning. Yes. So what is a skimming? What is a scanning? How should I effectively skim so that my time will be minimized and my outcome will be maximized? Minimum, minimum duration. Next one, maximum benefit. Minimum duration, maximum benefit. How can I? So now all of you share how you are doing this test. Part A, what you do normally. Can you share so that, okay, if all of you share, share your styles of reading part A. All of you, please share your styles of reading part A. Because today's lecture, when I start the lecture, it will go for 30 minutes. I did not start yet. So before I want to know what your problems are, why you are not able to get, or whatever it is, I'll tell you the topmost secrets. Even after getting the right answer, people will not get the mark. Why? You give the right answer, but still you will not get the mark. Okay? Why? See, for example, you provide food to your children or family members. You provide food to your children or family members, to your mother or father or brother or husband or wife or son or daughter or sister or brother, whatever. You prepare food and provide to. Now, when you are providing food, when they are sitting at the dining table, there is something called a decoration, orderliness. The way how you put food, there is a style, there is a system, there is a decency, there is a decorum. If you cannot put everything together as a heap and throw it out, no, you put the rice in one side and other materials, spice, subject, curries and other things on the other side. You'll not mix up and make a mess out of everything. That's called organization, orderliness, systematic presentation. You can say presentation should be excellent. It should be pleasing. You're right, giving food only. You're giving everything. But the way how you are presenting it to the other person is very important. If you do not present it properly, the other person will refuse. They will not accept your food. They will not accept your food. Okay. They'll think that you're not respecting them or you're disrespecting them. You're treating them as ah, take it lightly. So that's very important. Are you also doing the same? You're writing the right answer, but you're not getting the right mark. You deserve the mark, but you're not getting. Then what might be the reason? You have to focus. Yeah, right. So, good. Now coming to the point. Yeah. The first word is a skim, and the second word is a scan. The first word is a skim, and the second word is a scan. Number one, I'll give you three words here. 3S technique. 3S strategy. 3S strategies. Okay. 3S strategies. In 3S strategies, number one, Peter, make a notes of everything, whatever possible from your side. So 3S strategies. Number one, or you say A. A is called skimming. A is called skimming. Now, how many of you know what is skimming? How many of you know what is a skimming? Can you write down what is a skimming in your own words? What do you think a skimming is? What exactly you do in the skimming stage? This is a very special stage. When you take the passage, first and foremost, you have to skim. So, Shilpa, yeah, you know. So what it is exactly, you write down there. If I feel happy with your explanation, then I'll give you the mic. Many people don't know what is skimming. They don't exactly know what is skimming. They do something. They do something. They don't exactly know what is skimming. Take an initiative. We'll blast today. We'll blast today. Ranjita Das, very good. Awesome. Okay. Skimming. What are you going to do? What information is there in the passage? Yeah. Swapna, good, good, good. All of you take time, 1 minute or 2 minutes. Okay. 1 or 2 minutes. Invite 3 or 4 friends today. We are going to blast the show. Give me energy. If I see more students, I'll get more energy. Okay. Take 1 or 2 minutes and invite as many friends as possible. We are going to blast the show today. I'm going to tell you the topmost secrets. Today you should mark my words. Okay. It is going to be history today. Take 1 or 2 minutes and invite your friends. I'm going to tell you top secrets. Once again, I'm telling you. Yes. Come on, write down. So, Ranjita Das says heading and subheading. Heading and subheading. Yeah. Both are very important points. So A is a skimming stage. The skimming stage. This is very important. Many people skip this one. So in skimming stage, there are two layers. There are two layers. Nazia Gafur, we did not start the scanning yet. We're doing only skimmings. Very good. You have written, that's very nice. What you have written, very nice. Okay, that's absolutely fine. Okay, scanning is a different one. So scanning is B. So skimming, and now let's see. Ranjita Das, she has said headings and subheadings. Yeah, that's fine. So A1, A1, the headings, A2, the subheadings. So these are the two layers. You're absolutely right, Ranjita Das. I appreciate you have given the exact version of what is skimming. Okay. Now, how do you know? Where did you learn that headings and subheadings you have to do? Can you give in your own words? Yes. She is one of my regular students. Yes, Ranjita Das. I'm giving you the mic now. Why do you think heading and subheadings you have to do first?
Yes, sir. A heading means the all the paragraph over it is what is the written all the paragraph. If you read the heading, then you can understand what is the things described in the paragraph. And also the subheadings is also related the paragraph that I know.
Yes. So how did you
Thank you,
know
sir.
this one? Where did you learn this one?
Uh, Sir, you learned me, and when I'm practicing, then I think that it is important because if you learn the headings, then you have some idea that what will be the in the paragraph written in the paragraph. If you read the paragraph, then it is wasting the time because time also is so consuming, so little time there. So if I just read the heading, then I have some rough idea that what the paragraph is written, what will be the things. So it is also time saving our in this reading part because only the 15 minutes in the reading part and 20 questions there. So it is if you follow the practice, then it will easy to uh, collect the answer in our own time. Otherwise, it is not enough. The 15 minutes you can cover the for 20 questions.
Yes,
So that
that's
heading and the subheading is the main part.
yeah, that's
Thank you,
absolutely
sir.
right. So you say that in our previous lecture, you attended a session, then that time you have learned that we have to do these two things in skimming because I have given other lectures that time. So fine, that's very good. You have given good information. Then, so that's absolutely right. That's absolutely right. So when you skim, you will know the gist of it. You will know the stem and the branches. So how it is a tetrafurcating. Bifurcating means two, trifurcating means three, tetra means four. So four angles. It is going into four angles. For example, if you go into a bank, in front of the bank, the name of that will be there. Indian Bank. Indian Bank. So that means it is a bank. When you go inside, you will see four rooms. One says cashier, one says branch manager, one says fixed deposits, one says grievances. So four branches. So that means if you have a problem, you're going to take the money from the bank, you'll go to the cashier. You'll not go to the manager. You'll not go into the grievance section. You'll not go to the fixed deposits. That means you should know where you have to go, where you are heading to. So this name of the bank, if you know, you will go to that bank. Then what you want, you will go there. If you want fixed deposits, you will go to the fixed deposit room. If you have problem and nobody can solve, you're going to start an account or something like that and some problem arises, then only you'll go to the branch manager. So like that, this is very, very important. So you should know where you are going, right? So that heading and subheading will give us perfect idea what it is all about. So in questions, we will know each question will fall into one of these labels. That's all. For example, when you come to my house, at the entrance there will be written Simon's house. So once you enter inside, there are four rooms and I have labeled them. One is kitchen. All the doors will be closed. They will not be open. One is kitchen. One is bedroom. One is hall. And one is living room. So there are many things, new things I have purchased. I purchased a pillow. Where will it go? It will go into the bedroom. I purchased a tape recorder. Where will it go? It will go into the living room. I purchased a knife, fork, and spoons set. Where will it go? It will go into the kitchen. So all the things which I buy for that particular house will go specifically into any one of these 4 rooms by default. So if you know which room, how many rooms are there, what are those rooms, then you will know where to send those items. Then when you know where to send those items, if I asked you to fetch those items, you will know where to fetch those items. If I say go and get me a pillow, I'm in the garden outside, I will tell you, you are a guest in my house and all the rooms are closed, only the entrance is there and all the foods are there and labeled. Now if I say get a pillow, you will go to the entrance, see the 4 doors and you will see there bedroom. You'll go into the bedroom, take the pillow, come to me and give it to me. Finished. So simple as that. This is called skimming. First you should know the house, and you should know the tetrafurcation. That means what are those 4 compartments? Text A, text B, text C, text D. You should decide and give that one word name. That's it. So that is a skimming. So now we are going to do skimming. Yeah, we are going to take just 3 minutes. 3 minutes for skimming. Right, here we are. Yeah. Yeah. Now we can see here. I am stopping my videos to avoid distraction. Now let us see here. Yeah. So now this is the first one here. Yeah. So now let us see here. Yeah, little bit of network problem, I suppose. Fine. Are you able to hear me? Yes, somebody write yes. Are you able to hear me? Yeah. So it it is hydration. L is the resident, and there are 11 side. So hydration, right? Now, what do you mean by hydration? What do you mean by hydration? Hydra, hydro, water, hydro, water, hydra, water. Hydration, hydration, dehydration, okay. Over excessive hydration, all are problems. All are problems. So now let us see here. Hydration means water. So elderly people, hydration problems. So now take this word, residential care. That means they cannot fend for themselves. We are we are skimming the title now. We are skimming the title. Residential care. Residential care. That means these are people who are dependent. They don't have anybody to support them full time for various reasons. And they are not at home. So they are staying in a residential care home. Somebody, they are paying or they are providing something so that they can get the care. They are helpless. They are helpless. So they, maybe they don't drink water properly. Okay. So they will get dehydrated. Or if they drink more, they'll get excessive hydrated. So problems are three levels. Hydration means you have to drink at least from this much to this much. Require 4 to 6 glasses every day, or 3 to 4 liters of water every day. If less than that, it is a dehydration. If it is more than that, excessive hydration. That also is a problem. This also is a problem. Both are problems. Okay. Both are problems. So now coming to the point, elderly people, old people, they cannot go take water. Why to go? Somebody will come then. That. So somehow or the other way, they forget and then sleep, and then afterwards they don't drink. They get dehydrated. I'm just giving these all things should go on your mind. Next one, hydration. So it is talking about residential care. No, not all residential care. A part of residential care. Residential care may be many people. Okay, children also may be there. Medium age people will be there. Old age people will be there. Anything. So among them, elderly people. Is it for all elderly people? No. For those people who have hydration problem, only those people. Normal, no. Only those people who don't drink properly. So that's it. So hydration is the main topic. But in the elderly, in residential care. So hydration is the topic here. Hydration is the topic. Remember that. Hydration means consumption of water, required amount is hydration. Proper hydration. Okay. Consumption of required quantity of water is called hydration. So that's it. Now this one, now let's go into the second level, that is subheadings. So the main word is hydration. After skimming the title, the only one word is hydration. Only one word is hydration. Then next, we are going to the texts now. We are going to the text now. This is text A. Text A. Now think about one word which is new. Which is new. Can you type the one word which is new here from the title? Subtitle? Which we have not seen earlier, the title. Title you have seen, hydration in the elderly in residential care. In the title, what words are not there? In the subtitle, what is that word? Can you write that word, all of you? Come on. Come on, all of you. Yeah. Physiological changes. Where are physiological changes? In the subtitle, don't go to the text. 1, 2, 3, 4, 5 paragraphs. We don't want a nausea. We want only subtitle. Only title and subtitle, I told you. Read that much only. Read that much only. Yeah. So, risk. Now see, there are three words which are very important. There are three words which are very important here. You have to notice that. Number one, so dehydration, you already have seen in the title. In the elderly, hydration in the elderly in residential care. So now, no, that is wrong. So hydration we have seen. So now you have to be very careful. What is the problem here? Your eyes are not seeing the important word here. Yes. You are not seeing the most important word here. If you see this, it is very easy for you. It is a dehydration, not hydration. It is D. D means less, reduced. Reduced. That is the most important word. Hydration in the elderly is already there in the title. Dehydration. Dehydration means less. Remember that. Dehydration. That means less hydration. That means 100% hydration was there. Now it became less. So dehydration. Now for them, you have to give rehydration. Try to understand this. The technique here is, if you don't give hydration, there is risk. Because they are dehydrated, you have to make them rehydrated. Otherwise, they'll be at risk. So risk means problems. Problems. Okay. Problems. Right. Problems of dehydration. So A is risk. So when you see, first one is hydration, title. Title is hydration. Title is hydration. Title is hydration. A, subtitle A, okay, is risk, means problems. Risk factors or risks, we can say. Risk factors, risks. Plural, we can just say A. Instead of risk factors, we can just say risks. Why two words? One word. We have to bring it into one word. So risks, that's it. Do not read the text. Please. Again, I'm telling you, do not read the text. Believe me, one day, what is the problem if you are going to lose one day? No problem. From tomorrow, do whatever you want. Whether you want to follow this method or you want to follow your own method, that's up to you. First, learn. Next. Okay. Next, let us go to the next question, paragraph. That is text B. Text B. Now, text B. We have two stages here. Text B, we made two slides because it is big. Two slides. We made it big. Now, what is the new word you got it here? What is the new word you got here? What is the new word you got here in the subtitle? What is already there we don't want. Come on, write down. Participate. You should ready. You should be so fast even before somebody else is right. You should write. Others are writing. What is it for me? It's called lag. That is the reason for failure in many students. That readiness to participate is lag. Readiness to participate is lag. Remember that. Readiness to participate is lacking. So now this is assessment. So title B is, subtitle B is assessment. This is level 1. Okay. This is level 1. B is assessment. So fine. Here you will find the word repeated, assessment, examination. Okay. Examination. So these are the words: assessment, examination, evaluation. Okay. Right. So next one, we are going to see. Now, here also, what is the new word? New word which you got. New word which you got. I'll see how many of you will give the word. Swapna, fluid means hydration, water only. Fluid means water only. Recommended is not in needed. Recommended what? Medication? Huh? Recommendation is medication or treatment or anything else. What is the new word here? Okay, adults is there, residential is care is there. Okay. Yeah. Hydration, we know, title, hydration. Hydration means fluid. So only one word you have to take is intake. Intake. Okay. Consumption, how much you should consume. That is recommended only. Intake is the word. So C is equal to intake. How much Hydration should be there. How much you should consume water. C is intake. That's very clear. C is intake. Right. Next one, D. D also 2 pages it is. Two I made. Yeah. Now D. Now what is the new word here? You got. What is the new word that you got here? D. Yeah. Within seconds, we are going to do the answers now. Simon sir is requesting you to send these links to your friends. Yeah, D is management. Change it into noun. D. So you will bring noun forms. Mostly you have to change it into noun form. Management. iPhone. Who is iPhone? I don't know. Can you write your name, please? iPhone. Sir, I have not read. I have not this reading paper in hard form. No need. I'm not bothered. I'm telling you, don't read anybody. iPhone. Can you type your name? Is this iPhone? Who is this? NB. Who is this? Can you please type your names so that at least I know who I'm teaching? So iPhone and NB. NB means notebook. No. NB. So please type your first name and second name so that I'll know. Right. So we have now 4 different things. Don't read anything. No need to read anything. Yes. So risks, assessments. Thank you very much. Somebody has written the name. Nadia Batul. Very good. Thank you. You are very obedient. Teachers like obedient students. So NB, Nadia Batul. So I can help you. Yeah. Rename. Thank you very much, Nadia. You are very obedient. I like it. So iPhone. Can you also give your name? Zuhasha. Very good. Zuhasha, thank you. You are very obedient. So now I know you have attended 1 or 2 sessions. I know about you now. So I'm comfortable. Yeah. Right. Huh. So A is risks, B is assessment, C is statistics, D is management. Finished. Okay. So that is the point. Now let us see. Right. All of you, I'm going to, what is the title? Write and keep. Don't submit, please. Don't submit. The title. Okay. Now I'll count from 7 to 1. Then you have to submit. The title, it should be there on your mind now. Because you don't go to the passage every time. Just throw the answer like that. The title, be ready. Type and keep it ready. When I count from 7, the answer should be there. 7, 6, 5, 4, 3, 2, 1. Submit. What is the title? One word title I gave you. How many of you will write correctly? I'll see. So you people have forgotten mostly. Victoria has written correctly. Ranjita has written correctly. Swapna has written correctly. And Nadia Batul has written correctly. So that means you forgot. Forgot. So you should have that long-term memory in your mind. Develop that long-term memory. Next, text A, subtitle. Text A, subtitle. 7, 6. Think, don't check the answers there in the chat box. Okay, think, recall. You're increasing your memory power there. Okay, so 5, 4, 3, 2, 1, submit. Wait until I tell you, so that everyone can get chance to think. So A is risk. Risks. Very good. A is risks. Then B. I'll put in front of you now. B. Yes. Don't submit until I tell you. Please control. Control. Let everyone get the chance. Okay. 7, 6, 5, 4, 3, 2, 1. Submit. Yes, you are gaining momentum now. You are getting now. You are getting into my track now. So if you memorize like this, it will be very fast. You will just run to the answers. Okay. Yeah. And so C, subtitle. So most of you are already typing and keeping ready, I think. I know. That is called, readiness to participate. If you don't have that readiness here, how will suddenly come in? How will it suddenly come in the exam? No way. Okay, don't be lethargic. Be active. Yeah. 7, 6, 5, 4, 3, 2, 1. Submit. That's it. That's it. That's it. Always try to bring it into one word. Yeah, intake or statistics. Intake is the right word, but statistics also is the right. Synonyms, na? Synonyms. This is level 1. I'm teaching you level 2 then. Because in the questions, different words will be there, not the same words. Okay. So D, subtitle. D, subtitle. Okay. 7, 6, 5, 4, 3, 2, 1. Submit. Now it comes to you are going to jump into level 7 now. You are going to from the ground, you will jump into the sky now. You will be flying in an aeroplane in the clouds. Now next stage is going into the clouds. Wild imagination. Wild imagination. I will tell you now. Okay, I'll tell you now. The title is hydration. The title is hydration. Now you have to jump wild, leap into the skies, into the clouds. Okay. Now what I'm going to tell you is hydration. All the words related to hydration you write. Because in the question, they will change the words and give. Na? They'll change the words and give in the question. Come on. Write all the words. Hydration, dehydration, rehydration, then taking water. Okay. So water levels. Okay. Whatever you get idea, you will get number of ideas. Even I don't know those you will write now because you are medical professionals. Come on. Write down. ORS, very good. See, new word has come. Consuming water, very good. Come on, think about all the possible words and write, because all these words will come into the question. Any word may come anytime. So all of you help everyone. Yes, please. Yeah, fluid therapy, very good. See, come on. Moisture, yeah, right. Humidity, moisture, water intake. Think about anything possible. Humidity levels, yeah. Then next, risks, synonyms of all the risks, problems, difficulties, concerns, issues, hindrances, anything, all the synonyms, because these words will be there. These words will be there. Dangers, difficulties, okay, problems, concerns, issues. Yeah, hazards, very good. Come on, come on. Sheetal, afterwards make notes of all these things. If you don't write also, no problem here. Sheetal, if you don't write here also, no problem. You write in your notes, because these are very important. Okay, make a note of all these words and put there. This will be useful for everyone. Okay. Yes. So now next one. B, assessment. Yeah. Assessment, evaluation, examination, analysis, diagnosis, test, laboratory test, whatever, reports, do whatever. Preliminary diagnosis, signs and symptoms, observation, checking. Come on. Zikriya Bhatti, spelling evaluation, not evolution. Yeah. Come on, write down. These synonyms will be there. Very good. Lot of words are coming. Next, C, intake. Intake. Intake, consumption, drink, consume, uh, quantities, numbers, values, figures, okay, statistics, data, okay, liters. Anything may come. Anything may come in the question. Okay, figures, values. Inhale means breathing, Shital. Yes. So now we are ready. Next, D. D is management. D is management. Yeah. Nadia Batul. Treatment. Careful, dear. Yes. Management, treatment, therapy. Okay. Supervision, observation, care, follow up. Okay. Yeah. So, right. That's it. Now get ready. We are going to attack now. Take your notebook. Write there 1 to 7. Not 1 to 7. Write there 1 to 20. Write there 1 to 20. Okay. Write in your notebook 1 to 20. Okay. So take your paper. Okay. Take a paper and one side you write 1 to 10. Another side you write 11 to 20. 1 to 10, 11 to 20. Okay. So I'm helping you to increase your memory power and speed reading techniques. Just follow. You cannot do it on your own. You need somebody step by step, stop and go, somebody to monitor you. Okay. Like traffic lights. I'm going to help you like traffic lights. Otherwise, there will be accidents. Yes. So, if you are ready, just type Y. If you are not ready, just type N. I want to see how many of you are ready. Munawara Ali is not ready. Okay, write down. Write in your notebook. Yeah, Razia Parveen, write in your notebook 1 to 20. Munawara, write down. Okay, write down 1 to 20 in your notebook. Yeah. I showed only titles and subtitles. That's all. I showed you only titles and subtitles. When seeing the question, immediately you should recall ABCD. Asif Ali Lashari, no problem. You can travel. Yeah. So 1 to 20. Write in your notebook or anywhere. Yeah. Fine. So risks assessment, statistics management. You need not think about this one because it will be there always there. Okay. 1 to 20. Write down no? 1 to 20 numbers. 1 to 20 you can write Zuhasha. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, one side. 11, because you will write the answers there. Na? Just write ABCD there. That's all. Okay. You want me to show that also? Okay, I'll show you. So, okay. Blank document, layout, orientation, landscape. Yeah. Yeah, here it is. So this is hydration. Title is hydration. Okay. So hydration. Okay. Now here, one. Yeah. Yes. So like that. So this is what I told you. So you can write their numbers. A, B, C, D, whatever you want to write, you can write there. I just gave you A, B, C, D. You can write any word you can write there. Just write, take a notebook and write there. When I give you the question, immediately you write there. Okay. Which paragraph it is you have to identify. I'm making you to think very fast. I'm making you to think very fast. That's it. Okay. I'm making you to think very fast. That's it. Right. I'll count only 15 seconds, 15 seconds. Okay. Or I'll see. Yeah, I'll give you the number counting here. In 15 seconds, you have to write whether it is A, B, C, D or not. Okay. So let me take from here. From where, from where, from where? Yeah. Timer, right? Timer. Boomerang. App series. Yeah. So here. Yeah. So 15 points, right? Okay. Get ready. Yeah. I'm closing my video. Yeah. Remember these words. The words will come there. Okay. Yes. Question number 1. Round 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. See in the white area. That white area is only the question. Focus only on that one, nothing else. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 10, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 10, 11, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Done. Yes. Now, there you are. Very good. Very good. Did you write in your notebook also? Now, how do we know? Okay. Yes. Very good. Those who have written in notebooks, you can check questions 1 to 7 now. Okay. I'm going to show you questions 1 to 7 now. Answers. Okay. Yes. Yeah. Question answer. Number 1. Yeah. Number 1. Number 1. Yes. Number 1 is B. Those who have got 1 mark, write 1. Those who have got a 0, write 0. Yeah. This is the first answer. Come on. That's why I told you to write in your notebook. Okay. So this is the first question. Yeah. So this is the first question. Okay. Is a B. How to determine? How to determine? How to determine means how to evaluate, how to diagnose, how to assess. Assessment. Okay. That's it. So simple. One word. One word will help you. What is the right answer? That's all. Next, second question. What about the rest? You're not active, right? No problem. Okay, those who are active, let me understand. They will definitely secure. Okay, question number two. Question number two is this one. The amount that patient should drink over a 24-hour period. Okay, now, yeah, let me show you the answer. The answer is C. Yeah, if it is, add one more mark to your previous mark. Add one more mark to your previous mark. So 2 out of 2. Or just add to your previous mark. If it is 0, put 1. If it is 2, put 2. 1 plus 1. If it is 0 plus 0, 0. Whatever it is. Yeah. So now here you can see the amount that patient should drink over a 24-hour period means quantity, amount, number of liters. That is statistics. So simple as that one. Next, the third question. So that is C. Yeah. Third question. Information to obtain when an individual enters residential care. Information to obtain. Information to obtain means you'll take the information. That means you are asking the person about what it is, everything like that. That is where you will see, is it in risks or is it in assessment or is it in statistics or is it in management? Now let us see the answer. The answer is here. B, when they enter, you will ask them how much water you take, all these things. Okay, right? So that is individual enters residential care. All the information you ask him, do you have any problem? Everything. That means you are assessing his level of hydration. Okay. You are assessing, you are asking and finding out. You are inquiring. You are evaluating his level of hydration. Okay. Right. So update your marks, please. Update your marks, please. Then next. So that is B. Next question number 4. How to deal with a case of dehydration? How to deal with a case of dehydration? Yeah. So this one, the answer is yes. Dealing. Dealing means manage. Deal means manage. Deal means manage. Management. Deal means manage. Management. Deal means manage. Management. That's all. What's the drama in this? What is the drama in this? Huh? Update your scores out of 4. Yeah, very nice. This pattern is very nice. 3 by 4, 2 by 4. Very good. Come on, come on. Very good. Yeah, right. Next, fifth question. The correlation between body size and fluid intake. The correlation between body size and fluid intake. That answer is C. Yeah, the answer is C. Body size and fluid intake. Fluid intake. Yeah, figures, value, statistics. Body size. This many kilos weight. This much water he should drink liters. So simple as that one. For this one, you need a passage. You want to read and waste your time? My students are not crazy. They are very clever. They are very wise. See, we did not read the passage. We did not see the passage. Still, we are getting the marks, na? Yeah. Next, sixth question. Indications that a patient may have consumed too much liquid. Too much liquid. Okay, indications. So, now first of all, dehydration over. So, you are asking him to drink more. Then he has drank too much. So, where will you find this information? First, he got dehydrated. So, you asked him to drink water. So, he started drinking and he is drinking too much, more than required. Yeah. So, answer is here. It's a D. You're managing, but not managing properly. Okay. It's overhydration, excessive hydration. Dehydration is not a problem. Dehydration is a problem, but excess hydration is not a problem. You have to reduce little, that's all. Okay. So he is dehydrated. You're asking him to drink water and he's drinking too much. So in management problem, na, you're not managing properly. Okay. Then next one. Conditions which increase the likelihood of dehydration. Conditions which increase the likelihood of dehydration. Now let us go to question number 7. Yeah. Increases means more problem. Problem worsens. It is A. So conditions which increase the like dehydration itself is a D means negative. Increasing negative means risk. Dehydration itself is risk. Okay. Excessive hydration is not risk. Okay. Excessive hydration is not risk. Just reduce it little enough. It's not a risk there. Not drinking water is a risk. Okay. Overhydration is not a problem. You can adjust. Okay. So now, so very good. Out of 7, you got Zarka got 6, Ranjita got 5, Nazia got 6, Nadia got 5, Swapna got 5, Victoria 3, Nadia Batul 4, Ranjita 4, Zarka 5, Swapna 4. Okay, fine. And there is Razia Parveen 3. So that's how idea. Okay, now next questions. First we will go check the answer. Then afterwards we'll find whether it is in the right ABCD you have written already. Okay. ABCD you have written. We'll check and then we'll say whether it is right or not. Okay. Now question number 8. So you have to add 1 mark whenever you get. So we are treating this as ABCD only now. Question number 8. Okay. We are not bothered about the answer. Whether we are going to the right text or not is important. Nah? So question number 8 is here. What is the minimum volume of urine which a healthy patient, what is the minimum volume of urine which a healthy patient should produce per day? So now, yes, now write down ABCD. Which one you wrote? Repeat now. I'll take you there. So you are actually assessing. These are signs and symptoms. These are signs and symptoms. You are assessing a patient whether he is healthy or not. Don't you understand that? Minimum this much volume of urine if he puts, if he produces, then that means he is healthy patient. That means he is healthy or unhealthy. You are assessing him now. Do you understand? It's not intake, it is output. So drink intake, consumption of water only. How much weight, how much water he should drink. That is C. Okay. You are assessing how much urine output every day. That's it. So now let us see. What is the answer to number 7? I gave you the number 7, right? 7th is A. 7th is A. Victoria. Yeah. So what is the minimum volume of urine which a healthy patient should produce per day? That means you are assessing whether he is healthy or unhealthy. Yeah. So don't you understand that it is you are assessing whether he is healthy or unhealthy? When he is admitted, when he is being admitted into the care home, you will assess. Is he drinking properly? Is he producing output properly, urine output? So you are assessing whether he is healthy or unhealthy. Okay. So that's it. So now let us see to the answer. The answer is 700 ml. 700 ml output, not input, not intake. It is not intake. It is output. So definitely not C. Okay. Now let us see. Go there and see. Okay. Let me take you to D. D is here. Okay. D is here. Yeah. 700 is a number. Number is easy to find out. So number, no number in D. Yeah, here this is intake, only intake, no output. Where is urine here? Where is output here? Only intake. Only intake. Okay. Then here you see urine output here. Assessment. Hydration assessment. Yeah. Hydration assessment. You can see here. Normal output would be greater than 700 ml. So minimum 700. Okay. Try to understand this. Okay. So now if your answer is B, if you have written B, you can give 1 mark. If your answer is B, yeah, give 1 mark. Otherwise, no. Previous mark only you give. Okay. If you have got the B answer for this question, you can add 1 mark. If you did not give B, you gave C or D or A, you lost the mark. You should know healthy or unhealthy is assessment. Na? You are diagnosing whether it is healthy or unhealthy. Okay. Read between the lines. Read between the lines. Okay. How much urine output should a healthy person? Okay. How much output? Healthy person. If it is more than that, he is healthy. If it is less than that, he is unhealthy. That means he is drinking less water and he is giving less urine output. Means he is unhealthy. What is that, Victoria? Even from the world assessing, we can get assessment. Word. Yeah, you wrote world. I thought, where in the world? Which world you are? One letter confused me. See? Okay. Be careful. See here. Right. What is the minimum volume of urine which a healthy patient should produce per day? Healthy person should produce more than this volume. Okay. If he is producing 700 ml and more, that means he is healthy. Less than that, that means he is less water drinking. Finished. He is unhealthy. So you are assessing whether a person is healthy or unhealthy. Assessing. So assessment. What is the minimum volume? See, read between the lines. If you read the question, you will understand. Na? Who wants the paragraph? Then you can go there and find out the answer. From the question, you should get where you are going. Okay. Next question. So add your marks, please. Add your marks. If it is same mark, put the same mark. If it is 1 mark added for this question, if it is B is your answer, you can give 1 mark. Okay, next one. Question number 9. Which part of the body should be observed when assessing a patient's level of skin elasticity? Which part of the body should be observed when assessing a patient's level of skin elasticity? Now, come on, give your answers, please, first. I'll go there. Okay. Skin elasticity. You're assessing. You're assessing. Where will you go? So, assessing. The word is assessing here. Skin is elastic. Means it's coming and falling back to normal. Elastic means elastic, not plastic. Elastic. You know, like rubber band. You pull the rubber band and leave it, again it will come to its original position. That is elasticity. Your skin also, when you hold like this one, if it remains like that, okay, so it will go back to its normal position when you pull here. That means you are healthy. If it doesn't go to the normal position, it is just like that only, sticks on and stays like that only, that means you are unhealthy. Okay, so you're assessing a patient there. His skin elasticity is okay or not okay. That is also showing elasticity is okay or not okay. Assessing is one word. Elasticity, perfect or not perfect, that's another word. Two words are showing you. So now let us go there. Which part of the skin? There you will go and see in B. Yeah. Which part of the skin? Which part of the skin? Yeah. Elasticity. See the word there, skin turgor. Elasticity is here. We don't want the answer now. Answer you will write in the exam. But at least I'm taking you to the correct place, ABCD, without reading, directly going there. That's what I'm showing you. If you have given B answer, then your mark is right. Add 1 mark now. Question 9, right? Yeah. Yes. Question 9. If you have written B and you have gone right correctly, then you will add 1 mark. I want to see how many of you are scoring how many marks. How to go to the correct answer very fast. That's what I'm telling you. Without reading, you have to go there. Practice with me. Why you will not get 20 out of 20, I'll show you. Yeah. Yes, sir. Because Onam, I am giving a special offer. If anybody is interested, you can join the classes. So, if anybody is interested for these sessions, you can join. Silpa joined. Okay, these are all our regular students, most of them. Okay, Mirgam joined. Shilpa joined. Mirgam is going for the exam next week. Hello, Mirgam.
Yes, sir.
Yeah, are the techniques easy for you to understand? Directly jump into the answer where to go and there. Correct?
Yes, sir.
Yeah. Logical reasoning. Are you able to develop your logical reasoning?
Yes, sir.
Speed also is increasing.
Yes, sir.
Now you are not wasting your time reading everything, right?
No, sir.
So you are getting signs and symptoms. You are getting orientation. You are getting directions. You are getting pointers. Correct? Yes or no?
Yes, sir. Yes, sir.
Okay, fine. Yeah. So she's a new student who joined recently. Okay, so I gave her also. She is also on offer. This Onam offer. Onam is a festival here in Kerala. So I have given discount, 50% discount, and I have given Zarka. Yeah, if you are interested, you can also join like Mirgam. Mirgam joined just now. Okay, so I'll give you my number. You can contact me personally after the session. Today is the last day for this discount. Yeah. So uh,
Sir.
next question. Yeah, next question. Question number 10. Question number 10. Yeah. Which illness may affect the patient's ability to judge when they are thirsty? So try to understand this one very carefully. Affect judgment. Judgment is positive. Affect judgment is negative. Illness, negative. Thirsty, not able to judge. They should drink or not. That is again negative. So try to understand which illness may affect a patient's ability to judge. So you are able to judge when you are thirsty. I am thirsty, so I'll go and drink water. But there is a disease. There is a disease. If you have that disease, if you have that sickness, if you have that ailment, mentally you are not capable to judge. Mental problem, mental disease this is. You cannot judge properly. So where will you go? Come on, write down ABCD. Come on. You are not able to judge when you are thirsty. So you will not drink. So you will get dehydrated. So it is a risk. Okay, fine. Now let us see there. Let us go and see there. We don't know no, whether it is right or not. Let me take you to A. Okay, you have written A, na? So let me to take A. Yeah, check it there. Is it there? Is it there? Yeah. Age-related changes includes a reduced sensation of thirst. You don't realize that you are thirsty, and this may be more pronounced in those with Alzheimer's disease or those that have a stroke. Stroke is not a disease, na? Stroke is an incident. A disease is Alzheimer's. Both are right, but Alzheimer's you have to write. So now, if you got A, you can add 1 mark. That means you are going to the right direction. First learn level 1, afterwards level 2. So add your mark. That is question number 10. Yes, question number 10. If you can go directly there, you are saving your time. Otherwise, you need 30 minutes for this. Yeah. Right. Swapna is my regular student. Nazia, regular student. Sheetal, regular student. Ranjita Das, regular student. Victoria, regular student. Mirgam, regular student. Very good. Participating. Good. I like it. Yeah. Next question. Question number 11. Q11. Yeah. Want condition. Okay. What condition may make patients reluctant to drink enough fluids? What condition? What condition may make patients reluctant to drink enough fluids? Not interested to drink more fluids. What condition? Try to understand this one here. This is not a dehydration. Remember here. This is not dehydration. They don't want to drink water. Why? What condition? Think logically. You know this one. Your medical field. Even without common sense, you can do it. With common sense only, you can do it. Yeah. ABCD. Come on. Nazia Gafur. C. Okay. Come on. Come on. ABCD. Write down. Where you will go? ABCD. Not interested to drink fluids. Not interested to drink fluids. What condition may make patients reluctant to drink enough fluids? Okay. A. Right. Now let me take you there. Yeah. Is it there? Check. Is it there? Check. Yeah. Incontinence predisposes people to dehydration as they may limit their fluid intake. Incontinence, they cannot control their urine. So if they drink, they will go for urine. So they don't want to go for urine again and again. So that's why. So A is the right answer. If your answer is right, out of 11, question mark, out of 11. Come on. How many marks? Out of 11. A is the right answer. Incontinence. So when you get a question, are you going to the right paragraph first, ABCD? Are you going to the correct answer, location or not? That is very important. I'm teaching you, I'm training you how to go there directly without any confusion. Right. Next question number 12. What analysis might a doctor recommend for a patient diagnosed with dehydration? Doctor, what analysis might a doctor recommend for a patient diagnosed with dehydration? Doctor, the word is doctor. Remember, already diagnosed with dehydration. Already diagnosed with dehydration, and doctor is recommending. So now you have to think what is the right answer. A, B, C, D. The words are doctor and recommending. Analysis, diagnosis. Okay. What type of analysis he is going to send? What type of tests, diagnostic tests or something? Okay, now let us go there. So majority of you have said D. So let me take you to D. Yeah. Doctor. Where is doctor? Find out. It will be easy to find out there. Yeah, here it is. Refer to a GP to consider blood tests and withholding certain medications. Refer to a GP. GP means doctor. Doctor is here only in management. Refer to a GP to consider blood tests and withholding certain medications. So consider blood tests. What analysis? Blood tests. So if your answer is right, give a mark. The answer is a D. You're going to the right location. GP means doctor only, na? Yeah, GP means general practitioner. General practitioner is who? Doctor only, right? Other name for doctor. Doctor may be different labels, but GP is also a doctor, na? General practitioner, special practitioner, private practice, okay, or head of the department, or chancellor, or a dean, whatever it is. Doctor is a doctor. A surgeon is also a doctor. Okay, fine. So GP means doctor to consider blood tests. Doctor is the other name. GP is the other name for doctor. Okay, all right. Physician, general physician also we can say. Okay, general practitioner, physician, doctor, different labels. Right. Consultant. Who is consultant on duty? Doctor. Okay, right. The next one, we are going to 13th question. Yeah, 13th question. Come on. If the daily intake goal is on target, how long should you wait before reassessing the patient? Where will you go? Question number 13. Q13. Q13. Okay. Yeah, Q13. If the daily intake goal is on target, that means you are where? Be little choosy here. How long should you wait before reassessing the patient? If the daily intake goal is on target, how long should you wait before reassessing the patient? So there are options B and D. So majority is B here. Okay, let me see to B, then we'll go to D. So if the daily intake goal is on target, how long should you wait before reassessing the patient? Okay, here it is a twister. It may be B or a D like that. So if the daily intake goal is on target, so regular assessment maybe, or management maybe. Okay, let us see. So first let us go to B. Yeah. Waiting before reassessment. Conduct a physical examination. That is assessment. Yeah. So you have to be little choosy for this type of questions. Assessment, reassessment. You assessed and is dehydrated. So now you are managing. And when you are managing, okay, how long you have to wait before reassessment? Maybe, okay. So now let us take to D. Now you decide which is which. Yeah. Yeah, here or here. So you can check. So here it is. Monitor symptoms by repeating assessment. So you have assessed, he is dehydrated, you are managing him. Now, try to understand. It is reassessment. So don't you know that assessment and reassessment between there is management? Okay. So now you are tested. Then again you are going for test. In between that you will train yourself, right? Test, train, test. So here also assessment, you assessed, he is dehydrated. Now in between you are managing, that means you are rehydrating. Then again after 7 days, you will reassess whether he is okay or not. So monitor symptoms by repeating assessment. See, reassessment. Repeating means reassessment. In 7 days, if the daily intake goal is being achieved, try to understand that. So D is the right answer. If you got the right mark, you can give 1 mark. Okay. Next one is, so daily goal is on target. So after, if the daily goal is on target, after 1 week. If it is not on target, you have to extend still. So question number 14. Question number 14. Yes. How much fluid should a 190 centimeter man who weighs 70 kg drink each day? Come on, fat answer. How much fluid should a 190 centimeter man who weighs 70 kg drink? Means take, intake. So simple as that one. That is statistics. Numbers, figures, values. See numbers. So how much should you take? Answer you can go and find there. I'm not bothered about how to find the answer. That's very easy. Okay, I'll show you the technique. That's all. So 190 and 70. 190 centimeter, 70 kg. Go there. So there 190. 190 is here. Go in the different angle here. 190 is here. 190 is here. Go like this. Then 70 is here. Go like this. So that's it. So where both of them meet, that is the right answer. So 70 kg is here. So where both of them meet, that is the answer. Okay. That is the answer. So both of them meet here. Okay. So simple as that one. Finished. I'm giving you the angle, that's all. So it is directions, both of them meet. 70 kg and 190 both where they meet, that is the level. So simple as that one. You should draw lines like this enough. 190 downwards, 70 rightwards. Technique. Technique, that's all. So if you got the mark, give the mark. So once again, I'm reminding you, Onam offer only today before 12 midnight. Okay. Tomorrow again, it is full fees. Yeah. If anybody is interested, ask me. WhatsApp message. So Yes. So I'll give you my contact details. Contact the admin. Okay, especially offer is especially available for those students who are going for the exam. Mirgam is there. Like that, many students are there who have joined now for crash course. Special offer. You can ask me. I'll give you. This is my number. Sorry. Copy link. This is my number. That I'll tell you personally. This is training. That is personal. So we'll see later. Yeah, after this test, I will give you. So you can message me so that I can get back. So, so that is the question. Next. So marks, update your marks. 8 by 14. Okay, 14th question. Now 15th question, right? So round 3. All the questions are like that. First you read the question, go directly there. Find the answer and write there. Patients who have problems, dash, may be at risk of dehydration. Patients who have problems, dash, may be at risk of dehydration. A, B, C, D. A, B, C, D. Problems, dehydration, risk. Think about that. Yeah. So majority of you have written A. Okay, let me take you to A. Let us see. A. Yeah. Yes, I'll read the question for you. So the question should be there, na? Oh, I'll give you the question also. Wait. I'll give you the question also. Wait. Question number 15, right? So I can bring the question here. Yeah. Check it out. Now it will be easy for you. 5 more questions. I sent you my WhatsApp link. You can message me if you are really serious. Yeah. Yes. So have you got the answer? Patients who have problems, dash. Problems means difficulties. Problems means difficulties. Okay. Problems means difficulties. Hydration. Dehydration means poor hydration. Okay. So difficulties with swallowing. Okay. Difficulties with swallowing. Problems swallowing. Problems swallowing. So this is the way how you can identify. Difficulties with swallowing, poor hydration. Yeah. Patients, people. Okay. Yes, you can understand. Dementia is a mental condition. Okay. Poorly controlled diabetes is different. Problems, that is a disease. But problems with what? Problems with swallowing. Okay. So update your mark. Give your mark. Miriam, you should not write capital letter. Okay. Update your marks. Add 1 mark if you are A. If you come there directly, you can add 1 mark. Next, 16. Okay, 16. Urinalysis results showing high levels of sodium or an elevated dash are a sign of dehydration. Urinalysis results, urinalysis results, urinalysis, analysis, urine analysis, test, okay, results showing high levels, signs of symptoms of sodium or an elevated, increased, sign and symptom of dehydration. Yes. What do you think? A, B, C, D? I don't know. You have to tell. Question number 16. Question number 16. Tell me A, B, C, D. Yeah. Urinalysis results showing high levels of sodium or an elevated dash or a sign of dehydration. Yeah. See how many words are there. Urine analysis means assessment. Analysis, diagnosis, assessment, results, tests. Tests are there for assessment. Showing means signs will show, symptoms will show. High levels, elevated dash are a sign of the sign and symptoms. So let us go to B. Majority of you have given B. Yeah. So here it is, urinalysis. Indicated signs, indication, sign. Increased, greater. Increased, greater. Okay. That's it. So what is the answer you can find there? You'll go there and find urinalysis, you get such answer. I'm telling you, I'm showing you how to go to the right answer. That's it. So B is the right answer here, urinalysis. Okay, urinalysis, indication, sign, greater, increased. So add 1 mark. If B is right, add 1 mark. Those who did not write B, they can add, put previous mark itself. Yes. Next. Question number 17. A patient who is overhydrated, may have distended dash. Overhydrated. A patient who is overhydrated may have distended. Overhydrated, where you will be? Yeah, A, B, C, D. Hydrated, dehydrated, managed, then overhydrated. Overhydrated, the word is overhydrated. This is not a problem. Yeah, what is the answer you think? Majority wrote B. It's not assessment. It's not assessment. Okay, he's already overhydrated, you know that. He's already overhydrated. You know that. So what is the assessment there? Okay. So he may have distended something. Right. So now let us go to B and D. Okay. B. B is here. Assessment only here. Examination only. Blood pressure. Symptoms and dehydration. Symptoms only. So not possible here. Now go to D. D is managing hydration. Managing hydration. Assessed as a dehydrate. If a resident is assessed, establish it. Okay. So review, involve, document. Yeah. Overhydration is here. When symptoms are relieved, monitor the resident for symptoms of overhydration. Overhydration is here. When you are managing, you'll get overhydration for some people. They are drinking too much. So they will have distension. Where is distension? 1, 2, 3, 4. Here is distension. Distension of what? Is written here. So D is the right answer. If you have got D, you take your mark. If you did not got right D, then you lose your mark. Okay, 17. A patient who is overhydrated may have distended. So go to overhydration and see distended. Finish. Answer. So overhydration is in management. You manage and you could not manage properly, it became overhydration. Next, give 1 mark if you have written D. Next, if the dash and mucous membrane lining of the mouth are dry, this could be an indication of dehydration. Yeah. Indication means signs and symptoms. Signs and symptoms of dehydration, not overhydration, not rehydration, it's the dehydration. So signs and symptoms. Indication means signs and symptoms. Indication, indicator. You are putting right side indicator. That means you are showing a sign to the back side. People that you are going to the right side. That's it. So now let us check. Now after going to B, check mucous membrane and mouth. There you will find mucous membrane and mouth. Head, mucous membrane, mouth. Body parts. So go to B and check the body parts. Mucous membrane and mouth. Mucous membrane and mouth. Symptoms of dehydration. Symptoms means indication. Identifying observable symptoms. Symptoms means indication. Indication means signs. Signs of dehydration. In the head. So mucosa, oral mucosa, and tongue. This is in the head. This is skin. This is eyes, muscles, constipation, change in mental status. So dry oral mucosa and tongue. If you take those two words, okay. So lining of the mouth are dry, dry mucosa. Okay, no saliva. Okay, lining of the mouth are dry. This could be an indication of dehydration. So this is mucous membrane, mucosa, oral mucosa. Oral means mouth. Mucosa means mucous membrane. And another word. So that is, so word given before here, but their word given after. You want to see? Dash and mucous membrane. The word will be upside down. Front one back, back side front. So mucous membrane will be given forward and the answer will be given later. Let us see that. See the order there. He will try to twist things possible as far as possible. Yeah. Dry oral mucosa and tongue. Tongue is the answer that comes forward. Okay. So give the mark if it is B. If your answer is B, give the mark. Okay, the tongue before, there it is after and here it is before and. That's all. Next, 19th question. Give the mark 1 if you B is you have given the answer B. Next, an increase in dash is a possible sign of overhydration. Overhydration. An increase in dash is a possible sign of overhydration. Try to understand overhydration. Where you will go? A, B, C, D. An increase in dash is a possible sign of overhydration. Sign of overhydration, not dehydration. Remember. So where will you go? So majority A, B, C, D, all have given. Huh? So B, let me take you to B. Yeah, this is A. This is A. This is B. This is B. This is C. Nothing is there. So let us leave. D. Overhydration. So where you have found? You got it? You got it there? Okay. So now let us bring the question here. So I'll bring the question for you there. Yeah. You have to relate the words overhydration. Already one question also came from overhydration. Overhydration is in D. See, overhydration. Huh? Don't understand the relationship? Overhydration. Sign, symptom. Increase, gain. Huh? Shortness means decrease. The distension is different. Edema is different. Increase is gain. Gain in what? Huh? So simple as that. Weight gain means increase weight. Huh? Huh? Overhydration is in D. Dehydration is in B. Okay. Overhydration is in D. Signs and symptoms, that is different. Assessment is different. Okay. Here also assessment is there. Reassessment. That is preliminary assessment. This is reassessment. Okay. You have to read logic, apply the logic there. So if you have written D, give 1 mark. Okay. Yes. Next, last question. Staff should check whether a resident needs to use dash or adapted drinking vessels. Staff should check, 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 check. It may be related to B, it may be related to D. But try to understand resident. Okay. Staff should check whether a resident needs to use dash or adapted drinking vessels. Adapted means got used to. What it is? A, B, C, D. Question number 20. So D, B. Okay. Use dash or. There we have seen no and. Now here we are using or. A and B. Here A or B. So where vessels are there only you will see another equipment. Vessels is one equipment. Glass, bowl, cup, mug, jug, like that. So some other word may be there. So let us go there. Yeah. So this is a D. This is a D. Check. So this is D. This is second part. Vessels. Okay, remember that word vessels. Did you get it? It is in management. Management, resident, residential care context, resident. This is resident. Remember that. He came, that is assessment. And here he becomes resident. Okay. So B is assessment on admission. On admission. This is after admission. That means managing. So here, fluid volumes of drinking vessels. Fluid volumes of drinking vessels. Okay. Fluid volumes of drinking vessels. This is one. Fluid into up. Yes, this is, you can see here. Causes of dehydration, signs and symptoms, fluid volumes of drinking vessels. Okay. Drinking vessel, fluid volumes of drinking vessels. Right? Okay. So this is B. This is A. This is B. Check and confirm your answer. Yeah. Now check. Here it is. The residents' usual hydration habits and current fluid intake patterns, functionality and requirements for aids. Aids means equipment such as straws or special cups. Cups is vessel. Synonym word will they use. So here is the answer. Can you see here? If you have given the answer B, that is right. Okay. B is right. Staff should check whether a resident needs to use dash or adapted drinking vessels. So 20th question will be the most difficult question mostly. So you got the answer in B. Yeah. B. Check it out here. The residents' usual hydration habits and current fluid intake patterns, functionality and requirements for aids. Aid means equipment for drinking, such as straws or special cups. So vessels means cups. Or, see here, or is here. So before one answer, afterwards another answer. So instead of special cups, He has given what? Vessels. This is a vessel, but straw is not a vessel, right? Straw is not a vessel. It's an equipment, but it's not a vessel. So remember that. Okay, so straws is the right answer. So how many you got out of 20? Yeah. So we are just going to the answer. Afterwards, finding the answer, you that is the next step. But first, going to the answer area instead of wasting your time. I'm trying to help you to go directly to the answer. Yeah, Victoria. So now I think you understood some points here. Yes, Victoria joined today only. She's from Nigeria actually, but currently in the UK. She joined today. She is also blessed with a Onam offer. So Victoria. 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 Hello, Victoria. Unmute. Victoria.
Yes,
Yeah,
sir.
you can share your experience. How was the experience?
Mm. Oh, God. I don't know how to explain. Is it the teaching
No, I'm
or my
asking you,
score?
how was my explanation? Did you understand? Is it clear? Is this new student, your first class you are attending after joining? So that's why I'm asking. Is it clear to you my direction, how to go directly to based on some words?
Yes. Your explanation is clear, sir.
Then skimming is that one. Scanning means finding the answer. That is the next stage. How to identify the answer. Another day I will teach. Okay. So tomorrow I'll teach you how to scan and go to the particular word. Already I showed you, but not, I focused main on skimming. Okay. Skimming the
Okay.
questions and going to the text. That's all. So was it
Okay.
beneficial for you?
Yes. Yes.
Okay, fine.
Thank you, sir.
So welcome, welcome. Zarka. Hello, Zarka.
Yes, sir.
Yeah, how was the session for you? Did you learn some new techniques? Oh, you have some problem
So
with
it
the
was very
network, I see.
helpful for me.
Yeah. So share your experience. What did you gain?
So your strategies are very good and I learned a lot. Thank you so much.
You're welcome. Yeah. So the announcement goes, we have still 2 places and I'm going to fill them up by today midnight. So if anybody is interested, you can send a message to me on my WhatsApp. I gave the number already. So this is my WhatsApp number. Copy link. Yeah. This is my number. Yeah, WhatsApp number. You can send a message. Okay. Contact for subscriptions. Yes. So that's it. So that's the end of the session. If anybody is interested, you can contact me. There is a 50% discount for today. If you come tomorrow, it's a full fees again. Right. Thank you all. Have a nice day. Yeah, Christopher. Christopher is going for the exam next month. Yeah, Christopher, was that beneficial for you? Hello?
Sir, sir, identifying this like first 6 to 7 questions, how we used to do. If you are doing everything in the same way, we can identify the question easily. Answer
You can,
answer for the question
I,
easily.
yes, yes, yes. First part of the question, which paragraph answer is there? The A, B, C, D that you can identify. Afterwards, you can go there. Then we'll do scanning. Scanning, I'll show you tomorrow. Okay.
Okay, sure.
Right. Very good. Very good. Nazia Gafur. All of you write 1 or 2 sentences. Ranjita, it's a very useful class. Thank you for your valuable time to give us. Thank you, sir. Thank you, Ranjita. All of you write 1 or 2 sentences there.
Thank
Yeah.
you so much, sir. Today again, I learn a lot, mostly the skimming part. always I'm confused. I'm giving the subtitle and the other heading is wrong.
Mm,
But today, really, I learned. It's amazing for
mm.
me to
Yeah, Nazia
understand.
is a very Nazia. Your voice itself shows very confident level. You are a real darling for the teacher. You are a teacher's pet, definitely. Okay, that confidence, that happiness, confidence talks volumes. Very good. Thank you very much. Next,
Thank you.
Sheetal. Yeah, Sheetal. Sheetal, have
Yes,
you
sir.
made some notes?
Yes, sir. I have
Yeah,
made.
very good. Yeah, okay, so tell me, how was the session? How did it beneficial? This is a new. Every time I teach a lecture,
Yes,
and
sir.
it will be something new. Today also, is there that new
Yes, sir.
thing or not?
Yes, sir. Day by day, I'm improving myself. And today, earlier, I was doing like roaming here and there to find the
Mm,
answers. But now
mm,
onwards, I can directly jump into the paragraph
mm.
directly.
But practice is needed. You learned the
Yes,
technique. Now
yes,
practice
sir.
is needed, right?
Technique we have learned. Now we have to do hard work and
Practice, apply.
practice. Yes,
Application is there.
yes,
Learning is done. Application is important.
yes.
Yes. Sir, can I share my experience? Who is this? iPhone. iPhone, is it Zarka? Yeah, unmute Zarka. Is this Zarka?
No, sir, my name is Zohasha. I have written many times my
Zuhasha.
name
Yeah. Mm,
replaced to iPhone, but I don't know why it is changed. I don't know about
maybe.
it. But today
No
I have
problem.
learned actual meaning of scheming. Before I
Wow.
don't know what the scheming and scanning. Today this is very useful and it have cleared real concept of scheming. This is my
Mm,
point of view,
yeah.
and
So
it
very
is
good.
very
That
good
means you will go for from the
explanation.
question to the text. Yeah, yeah.
Yes,
Carry on,
sir.
carry on.
Sir, I am saying today this session is very useful for me because I have learned uh, actual concept of scheming, and it is very useful for students because most of the students don't know about difference between scheming and scanning also, and it is
Okay.
very good experience. Thank you so much.
Welcome, welcome. Thank you very, very much. Yeah. So, those who are going for the exam on the 20th, contact me because, okay, emergency basis for them, I'll give priority. Yes. Next, Sheetal iPhone. Okay, fine. So that's the end of the session. Have a nice day.